start to share my screen so that we can talk about vaccinations and some other things that are going on at the state level. I'm going to be joined this afternoon by Ronke Sudeepa, who's our Director of Consumer Services here at Regional Center of the East Bay. And we have Spanish translation on the interpretation icon at the bottom of your screen. So hopefully if that's something you need, you are able to get in there. So just to say a welcome, and I want to wish everyone a happy Lunar New Year. Today is the beginning of the year of the ox. And as I was reminded today in our provider meeting, we should be thinking about the strength of that symbol for this year as we are getting through and maybe getting out of the shelter in place and the challenges that have met us this year. It is also February, and February is Black History Month. And this is a month where we both really look at and value the contributions of Black Americans to the history of the United States, and also really take a deep look at the racism that still continues in our country. So I want to make sure we're all thinking about that as we move through the month of February. So I want to talk about the current status of COVID-19 in our counties. Since the beginning of February, we've really started to see a steady decline in cases and also a decline in hospitalizations. This is mirrored in the population of people served by RCB. We have also seen fewer cases in our congregate settings, and that may be because vaccines have now been provided in those settings, and that is really probably contributing to a lot of that. Across the state, we reported last month with data through the end of December that about 2% of people served in the regional center system had tested positive for COVID-19. You can see that at the beginning of February, that had jumped up to 3.6%. And that really does reflect what's been going on in the state as a whole. The demographics have changed just a little bit. We have seen actually a decline as a percentage in the cases among Latinos, but we have seen an increase in the cases among our white population. And the other populations have stayed about the same in terms of case ratios. For RCB clients, you can see the similar dramatic jump. At the end of December, it was about 1.3% of people served tested positive. And at the beginning of February, it was about 2.2%. Now, what I will say about that is that we are actually testing lower than the state as a whole in our community, but we may not have all the information because as case managers are reaching out to families, conducting annual meetings, they are finding out about more cases among, especially among people living at home with their families. And that's going to be an ongoing thing for the next period of time. And we also say similar trends actually with the ethnicity of people served and the cases across the state. You do see that the percentage of whites who have tested positive for COVID is much higher than would be expected. And I think that may have to do with something with age, because our population of younger folks is really much more ethnically diverse, and our population of people over the age of 50 is much more predominantly Caucasian. and African American than any other ethnicity. So there may be something to do with that and where people are currently living. And this is where the cases are found by where people live. And you can see, even though only 7% of regional center consumers live in community care facilities, that's where 28% of the cases have been. And where about 0% of our consumers live in nursing facilities, 4% of our cases have been in those facilities. And so that's pretty dramatic differences. 81% of our consumers live at home with family, and that's about 40% only of our COVID positive numbers. And that population is also made up of younger people and children. So that makes some difference as well. Just reminders about who should be tested. Remember that people experiencing symptoms are people who've come into close contact with people who have COVID-19 within the last 14 days should be tested. And there's ongoing routine testing now of people who are considered healthcare workers, people who are employees, as well as those living in long-term care facilities and skilled nursing facilities, and other people who have a lot of exposure to different populations. And if you're accessing our PowerPoint online, you can go to these websites if you're looking for testing resources. Because the numbers of cases have been going down, we are seeing it being pretty easy to get testing right now. It's the volume of testing has gone down, and so the number of appointments is a little bit more available. Now, the COVID-19 vaccines are out, and I want to just talk a little bit about the safety and what we know about the vaccine so far. And we did talk about this last month. All of the vaccines, which right now is 2, Moderna and Pfizer, were approved for use by the FDA after larger clinical trials, although it is still emergency use. The COVID vaccines will protect you from getting COVID-19. You need 2 doses. With Pfizer, it's at 1 dose and then 3 weeks later. With Moderna, it's 1 dose and then 4 weeks later. And the CDC, which is the Centers for Disease Control at the national level, and the California Department of Public Health, guided by vaccine advisory committees, make recommendations for who should be offered vaccine, because there really is limited supply at this point. Currently, the populations that are being vaccinated are healthcare workers, long-term care residents, and in many areas, people over the age of 65. We're working on this effort as well, along with our 2 county public health departments. The California plan is that vaccines will be offered to different groups of people in phases because the vaccine is limited now. We do expect that supply is going to increase. Aside from the federal partnerships for long-term care vaccine distribution, which that is to the long-term care facilities, and for us that has included ICF type facilities as well as community care facilities and nursing homes. In the next weeks, the state is going to pivot to a system managed through a contract with Blue Shield. Right now, they're still under a county management and decision-making system, but Blue Shield is actually going to become the contractor who actually is prioritizing where vaccine goes to, and I think tries to keep it similar across every county in the state. This came into place because there have been problems with the initial rollout and varying priorities by county, mostly, as I said, due to available supply. And the state really has at the core that equity needs to be at the base of whatever decisions are made about prioritization. And initially, the state planned to go through tiers for the vaccine based on both age and essential worker categories. Most of that prioritization was related to the people most at risk of contracting COVID-19 due to being essential workers, as well as really trying to kind of bring in healthcare workers at high risk and elders. People living in congregate settings and their staff were separated into the federal partnership so the vaccine could be brought to them. That group was considered to be 1A. And it included the healthcare workers and long-term care residents. Last month, additional clarifications started occurring to who would be included as a healthcare worker. And so over the last month, we've seen that expanded in our service system to workers, such as those who are ABA workers, those who are direct care staff through respite agencies, regional center staff who have quality assurance and case management roles, in clinical roles, and family caregivers. In-home support workers have been in that category from the beginning. And phase 1B, tier 1, is very confusing with all the tiers, in my opinion. Originally included individuals 75 or older, those with risk of exposure at work in education, childcare, emergency services, and food and agriculture. In early January, the CDC put out guidance that everyone 65 and older should be prioritized because of increased risk of severe illness and death. It added to confusion because in some areas, because the guidelines for phase 1B tier 1 were 75 and older, counties were limiting the group to 75 plus. In other areas and other providers were adding people 65 and older. And so people who were in that group as educators and childcare workers and emergency service saw their ability to get vaccine moving further into the future. And that was especially true for people with chronic health conditions. The governor hadn't made this announcement then that California would go along with what the CDC said and move those 65 and older to tier 1B. But then the governor said that they were going to shift all those categories that had been there, tier 1B, tier 2, tier 1C, and they would finish 1B, tier 1, and then move to an age-based prioritization. Again, that was met with frustration and some anger, as no one knew where they would fall or could predict when their turn would be. And there were also concerns about equity, as the communities with the most serious overall impacts were not getting the most vaccine. In California, the communities with the most impact have been the communities where a lot of the population are essential workers or where people live in very crowded housing environments. And in California, we've seen the most cases and the most deaths in the Latino and African American community. So the statewide COVID Vaccine Advisory Committee is comprised of public health officials, advocacy organizations, and others involved in public health to make recommendations on the prioritization of vaccine. And at that committee, people with chronic health conditions and disabilities and intellectual and developmental disabilities haven't been a clear priority group for vaccination. And advocates and self-advocates and their supporters have really been pushing to have people moved up in the priority list. Until last week's task force meeting, there wasn't much movement on the issue. However, last week, there was a decision that the concerns about prioritization of those with chronic health conditions would be moved to another group called the Drafting Guidelines work group to look at how that could be done and how there could be some prioritizations for people who really were at risk due to chronic conditions. And then this Monday, a reporter at a governor's press conference in San Diego asked the governor directly about those with IDD. And he actually said that there would be a plan for the prioritization, I think he said prioritization, released today, this Friday, the day we're on. Unless I haven't checked the internet, I haven't done that during this talk. I don't know what that is yet. We have not seen that released yet. This is just some information on vaccines I want to have as part of the PowerPoint as we move forward. But as I said before, there are 2 vaccines currently. The promising new development, which gives us hope as we think about all these prioritizations and wondering where we are, is that Johnson & Johnson, which is affiliated also with a European company, Janssen, have data on their vaccine, and they've submitted it to the FDA for emergency approval, and that's going to be reviewed on February 26th. It's a one-dose vaccine, and it's similar to what's been developed for vaccines for the Ebola virus. It also doesn't have delicate storage requirements, and its effectiveness has been good. It's been in the 70%, and no one who had the vaccine had serious illness or death. And yesterday, we also got an announcement from the Biden administration that the federal government had finalized agreements with Moderna and Pfizer for enough vaccine to be shipped for all adults in the US. And that's, I think, by the end of the summer. So that's all good news. Let me talk about the family caregiver issue. And then remember, keep your questions so that we can talk about them as we get to questions and answers. Initially for family caregivers, and we have had to communicate with a lot of people served in families because guidance keeps changing, we were told that family caregivers could use any kind of documentation from the regional center to prove that someone was a family caregiver. This guidance came from the Department of Developmental Services and said that family caregivers who provided direct support to a family member could be considered as healthcare workers. However, most healthcare systems and counties were reluctant to accept the Department of Developmental Services letter and would only honor guidance from the California Department of Public Health. And so last week, the California Department of Public Health clarified who was a healthcare worker if they were a family caregiver. And based on that guidance, and I'll explain the categories, Regional Center of the East Bay will complete documentation letters for family caregivers who fall in the named categories, and that information is documented at RCB. It doesn't include all people served by RCB. So this is what the California Department of Public Health said on their website about family caregivers. Family caregivers with direct risk of COVID-19 exposure who care for regional center consumers at high risk of COVID-19 complications and related fatalities, interesting terms, include the following conditions: cerebral palsy, Down syndrome, epilepsy, and individuals who have specialized healthcare needs, including dependence on ventilators, oxygen, and other technology. It doesn't include other family members within the same household who do not provide direct care to the regional center consumers. And it requires that we have to verify the qualifying condition and caregiver status. So, and this is like who is eligible, is if you provide direct care in the household, and these are the conditions. And I'm gonna turn this over in just a second to Ronke, and I'm giving her a heads up so she'll unmute herself before we get there. You want to start with the latest directive, Ronke?
Yes. Good afternoon, everyone. So we received a directive. Actually, we received one a while back last year, and we were asked to contact all of the individuals that we serve. So we embarked on that. But we recently received another directive to contact all the individuals served within 30 days. We have just informed our staff, case management staff, of this week. And the goal of that is to inquire about health, safety, and well-being of the person we serve, and also all of the family members, and to obtain information regarding how many people tested, are there any issues about getting testing, how many people have been able to get vaccinations, and are there any needs around that, and also, our ongoing conversations around needs around PPE, personal protective equipment. And what is also interesting in this is we also will be asking if you want more frequent contact. So generally, of course, we have conversations around the birth month, individuals served, and we contact you, we hope, during that time. And then for individuals who are in residential settings, we oftentimes contact every 3 months. This is asking, do you want more frequent contact than that? And so please be sure to let your case manager know that information. What should you expect? How are we going to get this information out to you, or to ask you these questions? We're telling our staff that whatever method we usually contact you by, so if we've been sending emails to schedule meetings or email correspondence back and forth, then email would be the way. If we have been doing this by phone call, then that would be the way. And the information that we will be asking would be about current health and any needs, any illnesses since the last conversation. We would want to find out if the individual served and family members have tested positive for COVID-19 and when, and how's that going, and also about vaccination status. We do know that, Lisa just gave some information about family as caregiver, family members of individual servants with certain diagnoses are considered to be healthcare workers. So your case manager will ask you if you'd like to be contacted more frequently during this time. For people, I already went over that, but I'll go over it again. For people who live independently, as I mentioned, we generally contact them every quarter at minimum. And for people over age 3 living with their families, the contact is generally once per year around the birth month. And for those under 3 years, the contact frequency that's in our early start program is at least every 6 months. So do you need PPE? Do you need it for an individual served or family members providing care to a COVID positive individual? That would be some of the questions we would be asking. And then the individual that we serve or family member tests positive, if you need extra support, as typical caregivers aren't available, if you have a family member who's hospitalized and you need extra support, if there may be a need for out-of-home care for a period of time, those are the kinds of questions that you can, directly asking, but if you need support around that, please let us know those things. And if somebody's hospitalized, will there be more needs after hospitalization? So any kind of support that you might be needing after that.
Thanks, Ronke. I'll go on to the last slide and then we'll take questions. And if I am doing the PowerPoint, sometimes I go back and forth. So I want to remind everyone who's on the website, please, on the webinar, please share and let your case manager know of any needs you have at this point in time so we can follow up on those. We have our COVID testing and vaccination section on our website, and we are keeping that up to date. We're posting information on vaccines, who is eligible, and any opportunities for testing, vaccination for people served by RCB. Vaccines will allow us to start to reopen activities and engage with family and friends more safely. And I think that while vaccines will be something that many people are looking for, we do recognize that there are people who are a little more cautious about vaccines and want to think about what it means for them and what the risks are and what the side effects are and whether or not they're ready to have a vaccine. There is no requirement that someone be vaccinated, but I do expect that at a certain point, as more things reopen and vaccines are more broadly available, there will be other questions where there'll be an expectation in some settings that people be vaccinated. I don't know when that will be, since we're nowhere near that at this point. One of the other things about the vaccines is that as people are looking at how long the protection lasts, there is a lot of question about whether COVID-19 vaccines will be an annual vaccine similar to a seasonal flu vaccine, at least for a while. So those are the kind of things that we should start to look at. We are continuing as we wait for some announcement from California Department of Public Health and the governor to advocate for our people served to get vaccine priority. Those who live in congregate settings did get prioritized, but there are so many people who have underlying conditions who really are at risk from COVID-19 who want vaccinations. So we continue to advocate for that. People 65 and older in our population are eligible now for vaccination. And we have actually run a data run of those individuals if they don't live in licensed facilities, and are reaching out through the case managers to make sure they know how to get those vaccines. And I think as we move forward, the other questions we're starting to hear from is, what do people want to return to? Is there interest in people returning to what they were doing pre-pandemic? Are people interested in maintaining some of the ways that they have gotten services during this period of time, or some sort of hybrid? You hear about that with schools, and we may hear about that with some of our services. We don't expect any site-based programs to be reopening in the next month or two. It doesn't seem like that will happen. But there may start to be, as our numbers as counties go down, the opportunities for more people to get services, maybe outdoors again, and in those sorts of ways that have kind of been shut down for the last couple of months. So I'm going to close there, and I'm going to look in the chat to see what questions people have, and happy to take more questions. And if there's something I don't know and we find out in the next week, 2 weeks, we'll let you know, and we'll post that on our website. The other upcoming things are during March, we are going to have a lot of community meetings, because we look at in March at our POS expenditures. That's our purchase of service expenditures by age, disability, ethnicity, and language used. And so please look on our website for when those meetings are. They'll all be via Zoom, and we really encourage you to join those and share with us any thoughts you have on how we can improve and really promote equity for everyone in terms of services delivered. So let me go to the chat and see what if we have any questions there. And let's see. So there's a question from Renee. How long do you have to wait once you get the second vaccine to get on public transportation, BART, or bus? There's no reason why someone who has just had one vaccine has to wait to get on public transportation or BART. People should just wear a mask and practice washing their hands the way you always do. And it's really wearing a mask, and maybe if you're particularly worried, to mask. But they say that though full protection from the second vaccine will be in about 2 weeks from when it is administered. The recording we will put on our website. The next question, and I think Patricia, this is about the who is eligible for the family caregiver letter. It does not include autism. There is no evidence that there is a higher risk for people with autism to develop serious outcomes from COVID-19. That doesn't mean someone couldn't, but so the family caregiver letter does not include family members of people with autism. Okay, let's see. If you had COVID, should you get the vaccine? So people who've had COVID should get the vaccine because there's still no knowledge of how much protection there is long-term for the vaccine. And so that's really a question as to what that is, what the period is. So the recommendation is that people who get have COVID should get the vaccine. The next question is from Patricia. Do we know why some families who have children with autism have received a letter from their case manager and have received the vaccine? Well, the letter, we actually shared the letter from DDS that came out 2 or 3 weeks ago that really talked about regional center consumers in general. And we did not provide a letter directly from the regional center, but we did provide a copy of the IPP so people could take that to their healthcare provider. The guidance has now changed, and DDS did not issue the new guidance. The California Department of Public Health issued the new guidance, and that does not include people with autism. However, many people with autism also have other conditions. People with autism have a much higher rate of epilepsy, particularly starting in adolescence. People with autism can also have one of the other conditions. They may have Down syndrome, they may have cerebral palsy. So it's hard to know exactly what the circumstances are, and each case is individual. The other thing is that people who are family caregivers and IHSS workers can also get the vaccine, and that has nothing to do with their particular diagnosis. So if you're a family caregiver and an IHSS worker, regardless of what your family member's diagnosis is, you are eligible for the vaccine. So it's very complicated. One of the things, though, that I want to say is that there isn't enough vaccine for any of the categories that have been identified. The vaccine is not available in large enough supply. And so we may get people prioritized. And I think the message is, even if people are in a priority group, they still have to get in line and get an appointment from a county or from their healthcare system. And so it may be a while until anyone gets vaccine. And And so, you know, it's not necessarily a guarantee, I think, for any of our clients. And so, Patricia, I understand that there is confusion about that. However, as I said before, there was a different message given to us early, and then that message changed. And what we found was that originally many places were refusing to give people the vaccine who even had a condition that's now in CDPH's list because the guidance didn't come from the California Department of Public Health. We have made it very clear to our case manager that we can only provide the letter to those particular conditions, and hopefully there'll be enough vaccine. And if anyone is feeling like they're not getting a letter and they should be, please let us know. Reach out to us. But there definitely has been confusion in the messaging, and we definitely had many family members who tried to get vaccine and were turned away because the letter did not come from CDPH. It came from the Department of Developmental Services. So is there any plan for RCB to partner with another agency to set up a clinic? So yes, as soon as we believe that there are more groups of people who can get the vaccine, who are our consumers, we will work to get those clinics set up. Right now, if you're identified as a healthcare worker, you have access through either your primary health insurance or through the counties. But when we hear about larger groups of our consumers being eligible, we will work to see that there are places for people to go. And for many people, that will be to a congregate site. You know, they're opening up the Coliseum and doing those things very soon. But for others, we know that there will be a need for more specialized sites. And with Contra Costa County, we worked with one of our service providers who is a clinician. And because people over 65 are eligible, that site is actually serving some of our clients who don't live in congregate settings in that group. And we will be working to develop more of those opportunities so that we have more places for people to go, and there are ways for people to get vaccine that work for them. And it'll be a mix of things. We don't have direct access to the vaccine. And the other thing that's interesting is as the state moves to the federal partnership, not the federal partnership, the Blue Shield partnership, they're going to be controlling where the vaccine is. It's not going to be controlled by the county. So we're going to have to see how that all works in the coming week. So I did want to share that with you. Are there any other questions or things in the chat that people want to ask? I'm looking, you can raise your hand, or you can, I think you can ask to unmute. But I don't see any hands raised, and
I don't either.
so we'll stay on just a little while longer. We'll be posting this webinar on our webpage. Oh, here's a good question. Will staff be required to vaccinate prior to day programs opening? Not, most likely not at this point. And I think that will be a decision that is going to be made by the employer, so the person who runs the day program. And then it's probably going to be made by community care licensing for those programs that are licensed. You know, and there's always, even if a program decided that they wanted all their staff to be vaccinated, it is not legal to require that without allowing for exceptions and exemptions. And for adults, this is different than in the school districts, though. For adults, you have to offer exemptions for medical reasons as well as for religious reasons. Okay. So what happens when a client from a facility doesn't want to get vaccinated? You know, they're not required to get vaccinated. And so everyone will work with people to make sure they can understand the benefits of vaccination and help them with that. However, there isn't a requirement yet for people to be vaccinated. And, you know, so we'll have to work through those issues, and that will probably be in the future. Michi, you say that there are 3 hands raised. I don't see those people. Could you unmute them for me, since you're the co-host, I think?
Anna Ortiz.
Anna, do you have a question?
I think we need to unmute Anna.
Michi, can you unmute her or,
I'm asking her to unmute, but she's not unmuting.
okay,
Let me try someone else.
okay. Great questions. Yeah,
Did it go?
And
Oh,
Did
Anna,
Yes.
do you have a
Yes.
question?
Yes. Right now, we're in quarantine. My daughter
Mm-hmm,
and it's a 10-day quarantine. What the doctor said and that. But after those 10 days on them, do we have to get another test?
no. Actually, if you were either COVID positive or you were exposed,
Yes.
if you were COVID positive, you shouldn't have to get another test because you're still going to test COVID positive.
Yeah.
If you weren't COVID positive and you were exposed to someone and they told you to quarantine, it would be a good idea to get another test. Then you would know if you were COVID positive or not. But that would be the recommendation for that.
I was in a hospital
Oh, wow.
thank you.
and it affected my lungs
So are you doing better now?
a little bit better, but my daughter she had her test on Wednesday and she came positive.
Okay.
So, you know, that's my daughter's handicap. And
Yeah,
so that's my concerns, but I still have little problem breathing, but it was terrible, terrible.
yeah, it's a horrible disease. And I'm glad you're on the mend. But please, if you want to chat with Michi and give me your family's name so we can reach out to you about any other supports you need. Because it can be a long recovery period, and I wouldn't recommend you go get another test right now because you will most likely test positive maybe for up to 2 or 3 months. So
Yeah,
yeah,
I think that's what the doctor told me, to wait two
Yeah.
to 3 months, more or less.
yeah,
But
okay,
yes, it's just the processing time is taking long because due to the lungs, like pneumonia, it went
Yeah.
through, and that's what's taking a longer time to heal.
yeah. Well, take care, Anna. I hope you feel better soon and are on the mend, and we'll reach out to you as well. Michi,
you.
was there
Okay.
another?
Yes, the next speaker, Ada Luz asks.
Hi, Ada.
Hi, good afternoon.
Good afternoon.
I have a question. I am IHS worker,
Mhm.
and right now I missed the the schedule appointment for the vaccine for last month.
Mhm.
And I submit, at this point, I submit my email address to get a new confirmation
Mhm.
day. So what I need to do, that I need to still waiting, or there is another way that I can get the vaccine?
You know, if you're an IHSS worker, I'd recommend you just go on the county websites, or if you have Kaiser, go through them and again, tell them you're a healthcare worker and you should get an appointment. Now, it may take a little while, but you should be able to get an appointment. You also may want to look at some of the larger sites that are opening up, like the one at the Oakland Coliseum, and I think there's one in San Francisco now, and we'll be putting these on our website as well. What
Okay.
county do you live in?
I live in Alameda County.
Okay. Yeah, so the Coliseum will open up fairly soon, and that would be another location to go to. There'll be an appointment way. So,
Okay.
yeah. Okay,
Thank you
thanks
so
for
much.
joining us. Yeah. Anyone else, Michi?
There was Renee, but she's off the call right now. I'll
Okay.
call her and see what question she has.
That's okay. We had a question from her already.
Yeah.
So if there's not any other questions, I really appreciate everyone joining us today. We'll have another call next month, and please get on our mailing list through Write to Us and on our website. And please check our website back for vaccination stuff. We will update you as soon as there's on that website, as soon as there's new information. So you're kept current, and I'm hoping to have more opportunities to have places where people can go to get vaccinated. That would be a great thing. And so take care, stay healthy, and hopefully we'll be back together in person. I really would love to have some of these meetings where we'd actually be in person, but that'll be a while. So take care, everyone. Bye-bye.
Thank you. Take care, everyone.